It's a Health Topics Tuesday on SVI Media, once again sponsored by Star Valley Health today. And we are with Myka Veigel. He is with the mammography department at Star Valley Health. Myka, thanks so much for your time today. First off, I think this is the first Health Topics Tuesday we've had with you. So just tell us about yourself and what makes you a radiologist.
Sure. So I'm a physician. I went to medical school at the Kansas City University of Medicine and Biosciences. I did that from 2004 to 2008. A lot of people don't know the radiologist actually went to medical school and is a doctor. And what I decided to do after medical school training, just like your family doctor, you have the opportunity to choose what field you want to go into. I chose radiology. And I went to a 5-year residency at the University of Missouri, Kansas City. So what a radiologist does is specializes in imaging the body head to toe. We look at if you've ever had a CAT scan, an MRI, an X-ray, a nuclear medicine scan, ultrasound, any of these types of things. So a radiologist is going to interpret the imaging study that's done to help diagnose, help facilitate your primary care provider in diagnosing a condition, whatever it may be.
Of course, this time of year when we think of radiology, a lot of us turn to Breast Cancer Awareness Month. And with what you do in your department, mammographies, tell us how radiology and mammographies factor into this.
Sure. Okay. So mammography with Breast Cancer Awareness Month coming up in October, mammography has been shown to be the decrease morbidity and mortality significantly. And it's the primary method in which we use to detect breast cancer. So here at Star Valley Health, we have 3D mammography. That's what we have, which we've had that for about 2 years now. Prior to that, we had 2D mammography. So what we do with this is with women who meet the general population, age 40 and older, if they are healthy enough to undergo treatment for breast cancer or biopsy, etc., the recommendation is at age 40, come in and do an annual screening mammogram. What the mammography equipment does, it takes the breast and it compresses the breast, and then it produces an image by shooting X-rays through that breast. So, and I mentioned again, 3D mammography is what we have at Star Valley Health now. With the 3D mammo, what it allows us to do is look at different slices of the breast. Literally, we can cut it in it with a knife, and you can look at those slices in 1 millimeter thickness. So it helps us to diagnose and detect breast cancer.
Dr. Myka Veigel with us again this morning with Star Valley Health and Health Topics Tuesday. You mentioned some of the recommendations, the ages 40 and over. What other recommendations are there for women who need to get in and have a screening done?
Okay. So 40 and over is the general population. For some women who do not meet this criteria, the average women, 1 in 8, will develop breast cancer, about 12.4%. But there are some women who may have a higher risk. And those women, for instance, if they have a first-degree relative, a mother, a sister that's had breast cancer, say, for example, if they had breast cancer at age 40, they should come in 10 years earlier and start screening at 30. So that's just a sideline from what we normally do. But you talk to your doctor if you have some different risk factors that we may need to look at. So we talked about screening mammography. One other term you may hear is diagnostic mammography. And what diagnostic mammography is, it's for women who have a symptom. So they may have nipple discharge, pain, a lump, tenderness. So when that occurs, those women need to meet with their primary care doctor, set an appointment to come see us. What will happen is they'll have a workup that day with the radiologist present. The technologist will be there to take the images. We'll do a workup and look it up, work it up. They may have an ultrasound, which we can do at Star Valley Health. They may have a biopsy, which we can do. So that's screening and diagnostic mammography. We can do all of that here.
Dr. Myka Veigel with Star Valley Health. And of course, October is Breast Cancer Awareness Month. Dr. Veigel, thanks so much for your time. Anything else about breast cancer facts that women should know about heading into October?
Sure. Let me mention that, so women, if they come in for a screening mammogram, so that they know 1 in 10 women will be asked to come back for further workup. So in general, 9 of those 10 women will get a letter from us after their mammogram's done. In approximately a week, they'll get a result that will say your mammogram's normal or you need to come back for further workup. Of those 10% that we ask to come back, less than 10% will need a biopsy. I want women to know that early detection is important. 99% of women, if we find that cancer localized to the breast, the 5-year survival is 99%. It's 85% if it goes to the lymph nodes in the armpit, 27% if it gets to the rest of the body. And the most common symptom of breast cancer is there is no symptom. So that's why we want to find them before women feel them. We want them to come in, every year for screening.
Again, Breast Cancer Awareness Month, and Dr. Myka Veigel this morning with our Health Topics Tuesday on SVI.